America's most sustained increase in COVID-19 infections is poised to get even longer. The nationwide rise in cases that began in September is now in its 9th week. That's a longer run than the March-April wave that unfolded largely in the Northeast, and governors are beginning to act. With me now is Drew Armstrong. He's Bloomberg's senior editor for healthcare. Drew, how are state governments grappling with this rise in cases?
I think one of the things we're starting to see around the country right now is a increase in the number of targeted lockdowns. New York just announcing that they are going to do bar and restaurant closures after 10 p.m., seeing other similar restrictions around the country. New York is certainly getting closer to some potential closing of in-person instruction in schools. But those types of more targeted lockdowns or targeted restrictions are going to be more common around the U.S. as these case numbers really get higher and higher and higher, and we have uncontrolled spread in many places.
Drew, if we think back to how this has played out, at least in the United States over the last 9 months, what we've seen are really geographically targeted hotspots, things that are focused in different places around the country and indeed around the world. But what this feels like to me is this is like the entire United States right now with a new surge in cases, right?
Yeah, that's correct. I mean, there is certainly a lot of nuance to that. You look at places like South Dakota, where they have what's called a test positivity rate of over 50%. That means that more than half of all COVID tests that they run are coming back positive, whereas New York is closer to 3%. The big caveat there is that what your positivity rate depends on who you test. But what it does tell you is that cases are rising all over the country. Some places are really, really out of control, like places like the Dakotas, like the situation in Minnesota, where they really have no effect controlling virus whatsoever. Places like New York, dangerous signs in a place that has been through it already once before and is going to try and clamp down on this before they get back, like we do have in the Dakotas, upper Midwest and upper Plains right now.
Well, the big news in New York over the last couple of days has been the surge here and what that could mean for schools. We are very close to getting the positivity rate that would actually indicate a shutdown of in-person learning. What can the government here in the city and in the state do to actually ensure that kids are continuing to learn? Is there anything that we can learn throughout the world that other countries have done?
I think this has been a struggle that you've seen just all across the U.S. trying to figure out how you deal with virtual learning, which if you talk to any parent who's doing this, is just a disaster. Don't even without even getting into places where you have problems of internet connectivity, parents who do need to be at their jobs with the frontline workers. There are a ton of problems with doing this stuff online. And nobody seems to have solved it effectively in a way that really takes care of kids yet so far. I mean, I wish I had a good answer saying, hey, there's great lessons here. The biggest lesson is that it's not doing well.
Yeah, and I guess I wonder too just about how long we're going to be dealing with this. We got some positive news from Pfizer this week. It was tamped down a little bit in sort of the day 2 and day 3 analysis of the data and just how long it would take for a vaccine, an effective vaccine, to reach us. But we also saw some news from Moderna this week. Break down what we learned and what that means in the fight against COVID.
Sure. I'm going to rewind a little bit just to explain to our viewers and listeners kind of how these big clinical trials work. So when you're a drug company, a vaccine maker, and you need to run the final stage test of one of these vaccines, you're doing that out in the real world. So you sign up a couple tens of thousands of people. Let's say half of them get a placebo and then half of them get the vaccine. And then you wait to see how many people in those two groups get infected. Obviously, if a lot of people in the placebo group get infected, but almost nobody in the vaccine group gets infected, then you've got a working vaccine. But to get those results and to get them quickly, you need disease spreading around out in the community. If these people aren't exposed to the virus, then there's no way to know whether the vaccine is working because you don't get the chance to see which group gets infected. Are the rates different? During the summer, when we were in kind of a lull in cases, these trials were proceeding pretty slowly. Now we're in this explosion of growth where there are cases everywhere. And the kind of ironic twist on this is that these trials are reporting results very, very fast, but the people in the trials are being exposed to disease so much more. So, we went kind of a period of a lull of a few months when we weren't really getting results, and all of a sudden they're beginning to really stack up. So we're going to get answers on these vaccines much, much faster, fortunately or unfortunately, than we would have if the pandemic was well under control.
Yeah, it's a really mixed bag here, right? It's sort of a good news or bad news is good news scenario, but certainly I think more bad news. I do want to end on a positive note here, Drew. Our colleague Tim Lowe just now writing a story saying that Dr. Anthony Fauci says that COVID won't be a pandemic for long thanks to vaccines. The coronavirus could remain endemic for long, but not a pandemic. So take us through the difference there and how you're reading into Fauci's comments.
Yeah, think about this like, I dread making this comparison, but think about this how we think about the flu. It is a viral disease that goes around the world. We, hopefully get vaccines for it every season, and it controls this thing. We've never wiped it out. We probably never will wipe it out. It mutates frequently enough that it's very difficult to actually stop the spread of flu as a whole. We've actually only really eradicated one virus from the face of the earth, and that's smallpox. So it just means that this disease will be with us for a very long time, but hopefully the impact of it and the health consequences of it and all of these economic disruptive consequences of it will not be with us for nearly as long.
Bloomberg senior editor of healthcare, Drew Armstrong. Thanks so much for your time. We appreciate it this morning.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.